Hi, everyone, and welcome to our third VidaLive. We are so glad that you have joined us today. My name is Kristen, and I work for Impact Ministries as their Teams and Mission Engagement Coordinator here in Canada. And it's just so good to see you guys. I want to thank you for just taking this time to join us. We're really excited today to have the opportunity to hear about the Impact Medical Clinic, which is located in Guatemala. And I'm thrilled to have Ruth Peters with us, who is our medical clinic coordinator. And with her is Erika. And Erika is one of our Guatemala staff who works in the clinic. And today we're going to hear from them. We're also going to get a chance to hear from Dr. Chris Brandenburg, who is our medical engagement coordinator. And he's in the US, and he's going to share a bit of an update on the clinic and how you can be involved. So it's going to be a really great evening this next little bit as we hear about the clinic. So I'm just going to hand it right over to Ruth and Erika, and they're going to share a bit with you guys.
It's so nice to see you all there. We are here in the medical clinic. This medical clinic was started in 2009, and we're in Chia Corral. If you haven't been here, it's one of our campuses where we have a elementary school and a high school and offices. It's a really busy place. And so I'm just going to ask Erika a couple questions here. First of all, how did you get involved?
Yo llegué al ministerio en el año 2018.
I started working in Impact Ministries medical clinic in 2018.
Yo me enteré por medio de una publicación en Facebook.
I heard about a job opening through Facebook.
Y ahora mi función es coordinar principalmente lo que es jornadas médicas con los colegios del ministerio.
And now my biggest job is to coordinate clinics with the schools through Impact Ministries.
También realizamos jornadas de desparasitación.
As well, we go and we just deparasite the children.
Dos veces al año.
Twice a year.
Entonces también soy la responsable de coordinar dicha entrega de desparasitantes.
Giving all the kids their deparasite medicine.
También doy atención directa aquí en la clínica.
I also see people, students here directly in the clinic.
A los familiares.
And oftentimes their relatives.
A nuestros trabajadores.
The workers in the ministry.
Chequeos básicos.
Just basic check
con nuestros alumnos del ministerio.
With our students. What do you love about your job?
Me gusta servir. Gracias a Dios por la oportunidad de estar acá y poder servir a nuestros alumnos, no solo en situaciones relacionadas con su salud, sino que también el ministerio tiene como objetivo también el bienestar emocional y espiritual de nuestros alumnos. Cuando nuestros alumnos vienen a una consulta,
when our students come to see us,
siempre aparte de lo físico,
apart from just the physical,
yo pregunto si hay algo que podamos hacer en cuanto a oración con ellos, si podemos ayudarlos,
can we help them?
Y siempre hay una necesidad en la
always there's a need in the family.
Y a mí me gusta orar con ellos y poder ser parte de la solución de sus problemas, tanto físico como emocional y espiritual.
Emotional and spiritual. What does it mean to students and the families in the community to have the clinic?
La clínica es una bendición para nuestros alumnos y también para las familias. Tener, por ejemplo, nuestra farmacia.
To be able to have, for example, our pharmacy here.
Les voy a contar una breve historia.
I'm going to tell you a little story.
A la salud en Guatemala.
Health here in Guatemala.
Aquí en Guatemala la salud, el acceso a un servicio de salud es gratis.
Access to health services is free.
Pero normalmente si nosotros consultamos,
if we have a health,
no nos dan medicamentos,
they won't give us any
una
medicine.
receta.
They'll give us the word?
Prescription.
A prescription. Thank you.
Entonces, y hay familias de escasos recursos que no tienen las posibilidades de
Families that
comprar
are very poor
un
and they don't have the
medicamento o
money
el
to be able to
tratamiento.
buy the medicine or treatment.
Entonces, el apoyo
And so the help
que el área de clínica médica da
area the clinic can give
es poder despachar la receta o brindarles el medicamento gratuitamente.
For free.
Una de esas funciones es de la clínica y estamos bendiciendo la vida de las familias con los medicamentos.
That's one of the functions of the clinic is to be able to give them their medicine for free.
Entonces, esa es una de lo más relevante o lo más importante.
It's one of the most relevant or important
en cuanto a la farmacia.
as far as the pharmacy goes.
Entonces, como le digo, es una gran bendición la clínica para la vida de las familias.
To have the clinic for our families and our schools. What does it mean to have doctors come down from teams from North America?
La participación de nuestros grupos médicos o
Having
la
teams come
visita
down as visitors
aquí a Guatemala
to Guatemala.
Ha sido muy importante.
It has been
En
so
mi
important in my experience.
yo he visto historias de familias que los médicos han venido a solucionar, que los médicos han venido a ayudar.
Have come down and brought a solution or helped.
Entonces también yo quiero contarles una experiencia. Una vez vino un grupo médico, no me acuerdo precisamente qué año, tenía una especialidad solo en mujeres.
She was a gynecologist.
Y consultó la jornada, se realizó en las instalaciones de la clínica médica.
They had their team work at the clinic here in the actual
y
clinic.
La madre es una alumna, es la mamá de una alumna del ministerio.
A mother of one of our students that goes to school here in our school.
Se enteró de que había jornada médica, asistió a la
consulta. Heard there was a free medical clinic
y el médico diagnosticó cáncer en el útero.
Found out that she had cancer in her uterus.
Ella decía que no había visitado otros médicos.
She hadn't went to any doctors.
Porque no tenía las posibilidades para hacer.
She didn't have the money to do
y el tratamiento iba a ser muy costoso.
Was going to be very expensive.
Entonces se le orientó.
So they explained to her.
Se le dio seguimiento a su caso.
And then they kept looking after her case.
Pero lo que yo quiero, lo que es importante acá es que ella acudió aquí, confió aquí y entonces yo digo que esa es una bendición que los médicos nos visiten y que puedan ayudar, no solo de esa manera, sino que también hay muchas experiencias que se han vivido en cuanto a las visitas de médicos.
So many stories that I could tell you about.
Pero una de esas es muy importante y me impactó.
And that particular story really impacted me because.
Entonces la visita de nuestros médicos para Guatemala es una gran bendición.
A really big blessing to have the medical teams come down.
Awesome. Well, that's a really good segment into our next guest that we're going to allow for some time just to share a bit of his heart. But just thank you so much, Erika and Ruth. It's really great to hear some of what's going on and Erika, some of your story. And again, at the end of this, there'll be a chance to ask them both some questions. So just keep that in mind as well. But Chris, I'll hand it over to you and you can share.
Okay. So, hey, it's so great to see everybody out there tonight. I just thank you so much for coming. It's great to see some familiar faces and names. And I know if you're on this call that you've had some exposure to Impact Ministries, you know what they're doing in Guatemala or have some idea what they do in Guatemala and the love they have for Jesus there and what they're doing there in the name of Christ. And so that's such a big deal to me. And I'm just so happy that you all feel the same about it. As Kristen may have mentioned, so I'm the medical engagement coordinator for Impact Ministries. It's a role I took on earlier this year. I want to talk a little about what the clinic's done in the past, what it's doing now, and what we hope to do with it in the future. And I'll just start by telling about myself. But so I'm an emergency room physician in Indiana, so in the United States. And I started coming down with my wife, Rachel, to Impact Ministries in Guatemala in 2013. And we actually just finished our 14th trip there last month, and it was a great trip. And I still remember from my first trip there to my 14th trip there, just when you're there, you just feel like the biblical definition of things that Jesus commanded us to all to do is happening there every single day. I mean, every second of every day. And I just think, God told us to feed the poor. He told us to heal the sick. He told us to go and make disciples of Christ. And that happens every day there. And their feeding programs are feeding people that don't have food. Our medical clinic is healing the sick, and our school is making disciples every day, And so I just feel so good on there. And I know that I'm doing the things that Jesus commanded us to do. And again, if you've been there or you've been exposed to Impact Ministries at all, or Guatemala, you know that there's real needs there. There's some real needs there. And, there's poverty, obviously. There's a lot of spiritual needs there with the polytheism that occurs there. Witch doctors, people putting curses, the god of the sun, the god of the corn, all that stuff that you just know there's so many people that don't know the one true God and don't know Jesus and the love of Jesus. So there's a lot of spiritual warfare that goes on there. And so there's needs, there's medical needs for sure. And again, if you haven't been there, don't know, I mean, we basically just see lots of malnutrition in the clinic. We see, problems with basic hygiene that leads to a lot of chronic medical problems. So we certainly see, lots of worms, as Erika mentioned, deworming there, and children getting the deworming. But, basically the malnutrition, the poor hygiene, the chronic illnesses, there's a lot of them there. And in general, there's a lack of healthcare there, and certainly there's a lack of healthcare right there in Tactique where they're located. But certainly even the remote clinics are going out and doing remote clinics are even worse. So there's real spiritual needs there. There's real medical needs there. A lot of suffering. There's a lot of oppression and a lot of suffering. And so sometimes you think about how do these spiritual needs that we're seeing, how do they relate to medical needs? And I just think of the children there, and think of that poor dentition and how hard it is to worship Jesus. How hard is the devotionals to worship Jesus, or learn math when your teeth hurt, when you have tooth infections, when you're malnourished, when you're hungry, when you have certain medical conditions. So there's medical needs and there's spiritual needs, and medically, we try and do our best at taking care of those things in medical clinic, and that's our role. Some people don't realize also that there's such a spiritual need that's met in the medical clinic, and you may or may not know this, but we actually pray with every single patient. We actually ask every patient in the clinic if they want to have prayer, and sometimes they get multiple prayers. And to me, it's like the most rewarding part, because sometimes after we've taken care of their medical needs, they'll say thank you for that, and they'll be ask us to pray for their medical needs. But sometimes they just unload on the spiritual needs that they have, and I mean, just amazing that the problems with alcoholism, maybe their spouse has left them. It's a single mom now with 5 children. They don't know where their next meal is coming from. There's so many spiritual needs, but yet after we pray for them, many times they feel a lot better. And I've multiple times that people make statements like I know that God still cares for me now. Like, you guys came here from North America, you traveled 1,000 miles to see us and take care of us, and you're trying to help me, that like I know there's a God. I know that God hasn't forgotten me. I believe in Jesus and his one and only son. So there's spiritual care done every single day. And honestly, that's the most important part to us. We can do medical care anywhere as medical care providers, but we're going there for the spiritual needs. And our job is to go and make disciples. And so we're trying to care for the people of Impact Ministries. And so that's the needs that we try and meet there. In general, Impact Ministries has done a really good job of taking care of patients in places where there's not good health care. But basically in the past, as many of you may know, is we had visiting medical teams. So we would bring physicians down, we had visiting dental teams. And so prior to COVID, prior to 2020, we would have medical teams that come down, and a lot of them did come down. It was often sporadic, depending on the time of year. There'd often be months in between visits. So the hardest part was taking care of patients that had chronic illnesses that you knew needed follow-up, that they needed more help than you could give them that day, and it wasn't available. Maybe there was another physician coming for 7 weeks, or maybe 2 months even, or longer. Maybe you weren't sure of what kind of follow-up care you could get them. You certainly just worried about them falling through the cracks and taking care of them. So there's no follow-up care for patients that needed it, and a lot of times. And so you just feel like there was a lack of care because of that, and the managing of chronic illnesses just didn't happen. I know I left there multiple times just wondering what happened to several of my patients and wondering if they got better, if they made it or not. But I think care was really good when we had visiting teams there. We just didn't always have them there. And then of course this worsened with COVID, because last year basically there hadn't been a medical team there in about 18 months. And so there was a lack of functioning of the medical clinic there for about 18 months. And so all the chronic conditions obviously got worse, and there was less care there. As I've thought about this in my multiple trips and over the years, I honestly had thought a lot about, what can we do to improve this? And God had laid a few things on my heart, honestly, of how do we get good medical care there all the time? How do we make sure there's people there to care for patients when they need it? And and basically how to improve the medical care, but also how to get more providers there, how to get more dentists there, how to get more physicians there, how to get more medical teams there. And so actually I sat down with Les here, Les and Rita, our founders of Impact Ministry, Ruth, who's overseeing the medical clinic. I actually talked with a couple of physicians who I knew had made several trips there, and then a dentist who had made several trips there, and kind of came up with a plan, all of us, of how do we improve care and what do we do. And we thought the first step was hiring back some of the local staff. And as you saw Erika giving the first interview there, Erika was someone who had worked with the clinic before. And so we hired back medical staff that could be there, to take care of the patients that they had now, and to help with the students who had been out of school and that sort of thing. We also need to restock a lot of the supplies and medications. Like every medication was, out of date basically. So we had to completely restock the pharmacy because of the 18 months of it at a low level of functioning. And as far as the follow-up care and getting care and providing more healthcare and dental care, we thought we needed to basically hire a full-time physician or a local physician there. So we wanted to hire a local Guatemalan physician that could have monthly appointments. He could see patients in follow-up care. He could see patients that were seen by teams that were there before that needed more help. We wanted someone that was local, that obviously spoke Spanish, that knew the medical community very well there locally. But most importantly to us, we knew it had to be the right person because of Impact Ministries and their mission. So it had to be somebody who, loved the Lord, who believed in the mission of Impact Ministries and curing the ill and healing the sick and feeding the poor and all that. So we really felt like we had to find the right person, and really thought that would be very difficult. I felt like that would maybe be nearly impossible. But that was the second part. We knew that we needed to get someone hired to have regular appointment times. And then we knew we needed to recruit more healthcare providers and more dentists. So we have quite a few coming from North America in the past, prior to 2020, but we certainly needed more. And I'm actually hoping that becomes easier with time, because having a regular physician in the clinic available for monthly appointments is really going to afford us the opportunity to go and do more remote clinics. Actually, when I was there last month, we did a remote clinic, and that's actually very rewarding for healthcare providers, that we actually go into places that literally, I saw someone that had a blood sugar of 700 who had no idea she had diabetes, had not seen a doctor in like 40 years. And also in those areas, those same areas that lack medical care also lack, a lot of times knowing God, knowing Christ, because there's also not a lot of churches or teaching in that area. So it's very rewarding to go into those remote areas. And so our hope is that we could expand with more visiting physicians and dentists that could go in those remote areas once we had a local physician hired. And then we know we need to upgrade some of the supplies, basically equipment. Some of that stuff's either went out of date or become older or not as functional. So those were kind of our goals that we needed. So the past clinics always had a nurse there available, like Erika, and had some basic medical care, would have teams come in, but they weren't there regularly. So those were our goals. And so we're actually working on those things now. So we've actually improved some of those things already. So we kind of stepped out. We knew we were going to do some fundraising to fund those things, but we stepped out before getting the fundraising and said, we got to hire some local staff. So actually that's how Erika's here. And then she has another nurse who's working with us that we've hired to have some care available right now. We completely restocked the pharmacy with medications. And we had a full functioning pharmacy when I was there last month. And so we basically have supplied those things right now. Talking about hiring a physician, amazingly, Ruth and Les were able to hire a physician who actually had worked at the clinic before and been a director of the clinic. And his name is Dr. Rivas. He's a local physician and honestly, a wonderful Christian man. He shares the vision of Impact Ministries. He's very knowledgeable of the area and the healthcare in the area. So even when I was there last month, I saw something of like wow, this is more than we can take care of. Who can I send this patient to go see? You know, I was like, oh, well, there's a free medical clinic. If they go to this place or they go there, I can get them to see a heart doctor if they'll go there. And so just having that local knowledge is just so invaluable for teams that are coming. So we actually have Dr. Riva starting with a monthly. The plan is to get him doing monthly regular appointments starting next month, October. So hopefully that is going to happen very, very soon. So I can't tell you, I prayed for that for the longest time. I know many others prayed for that for the longest time, and what an answer to prayer Dr. Rivas is. So going forward, we've hired our local healthcare providers. We've hired a physician. We've stocked the pharmacy the best we can. We're working on hoping once COVID lets up, or is it certainly improved, we're hoping for a very active season in 2022 of multiple visiting physicians and medical teams, multiple dentists visiting, and other healthcare providers. So that's the plan as we go through. So like I said, right now we just started fundraising last month. We've definitely seen some funds raised. You know, our goal is to raise more. I would certainly say, you know, I thank you all for being here. I appreciate prayers of the things that have already happened faster than I thought they would happen. I thought this would take longer. So we're already getting up to speed very quickly. We have needs very quickly. I really would appreciate any prayers, you know, just a prayer for support. And again, if you've been to Impact Ministries, you see the work that's done there every single day and how supportive many people have been through prayers and other support. So I appreciate that. There should be a link in the chat box. If you want to give financially at all to it, there should be a link there that you can get on that link. You can also go to the Impact Ministries website. So there's a Canadian website and a US website that you can click on medical clinic. You click on donate, and then medical clinic, that sort of stuff. Also maybe of very much interest to you is on that website, though, also talks about the cost of things. I always find that interesting of you know, you can support a nurse for a day in Guatemala for like $35. You can support all the medications that we would give away in a day that we would give to patients for free for about $60 a day. So there's just some numbers put down there if you're interested and want to see that. I always find that very interesting. So again, I can't thank you enough for being here with us. I can't thank you enough for the prior support. And you know, again, if you have any questions at all, I know we have a question and answer session coming up. I'm happy to answer them the best I can. But thank you so much for coming, and God bless everybody for being here.
Awesome. Thanks, Chris. And as he said, we are going to go into a question and answer period. So if you have any questions for Chris, if you have any questions for Ruth or for Erika, feel free to just put that in the chat box below, and then we can read them out. And I'll just start with this question that got submitted earlier. And Ruth, I'll kind of ask you guys this question, and either you or Erika can answer it. But how does the medical clinic fit in with the overall mission of Impact Ministries? If we can unmute you.
I think she's still muted.
Oh, there we go.
Sorry, guys. Impact Ministries, we have the desire to help kids have a better life. Sorry, I'm nervous. We want to reach not just their education, but we want them to change their lives. So it fits into our whole view of really helping kids and their whole family to be well. If you're well, you're going to be able to receive education better. If you're not well, it's really hard to learn. It's really hard to learn about Jesus, even if you're not well and if you're not being cared for physically. So we want to touch their physical body here and bring them healing. Oftentimes, kids, you know, like Erika said, she brings them the deep parasite medicine twice a year because of the water and the situation just in general. You can get parasites several times a year, and so if you have parasites, you're going to be running to the bathroom. You're not studying, you're not learning, and so the medical clinic is really key in that. Just to look at the medical health, she does checkups. Every child, just to see, are they growing? How are they feeling? What are their complaints this year? Are they the same that they were complaining about last year? How are they doing? It's really important to have that one-on-one. And like she said, when she asks them, you know, what can I pray for you? to get a little bit of insight into the family. We've had situations where we need to get a counselor and to talk to kids because things come up that kids are willing to speak to you about when you're in a different situation and somewhere else where they feel safe. And so, yeah, it's really important. I don't know if that answered the question.
Yeah, no, that's awesome. So we have a question here. Just what is happening with quarantine? So, and I guess to expand on that, maybe you can share, Ruth, just where students are right now, if they're in school or not in school, and what that kind of looks like even for the medical clinic, if people are able to come in. I think we're back on mute.
So the kids are mostly at home still in Guatemala. They've had schools shut down most of the time since March last year. So the kids are mostly at school. The government opens up the doors once in a while and says, freeze it up a little bit. They can come in a few days a week. Other than that, the teachers are going to the kids' houses and scheduling to help them with their homework. And they have kids, it's not exactly in the rules or out of the rules. They let the kids come in certain days. A lot of the kids don't have any technology in their house. They have no way to download homework or join a Skype call. And so the kids are coming in. That's to do with COVID, obviously. So what we've been doing here in the clinic is Erika has been sending notes to different schools, different grades. So, you know, one grade would be, they'll get a note that certain date they're allowed to come into the clinic with a schedule of what time each, you know, timing it out so that there's not a lot of people, so that she can do checkups on the children. Just we don't want to keep leaving it. Last year when the clinic was closed for a little bit, we feel like the kids, you know, they have their needs probably went up instead of went down during that time. And so it's been really good. She's been really able to carefully plan out when to have people come in, how to have them come in distancing, so that we don't break any of the rules in that sense. And yeah, and to see the kids. We went through ¿cuántos colegios ya has visto todos los niños o has?
Ahora solo dos.
Los de aquí. So she's seen in the last month, 2 months, she's seen all the kids from the Chico High School and the Chihakuda School, which is the biggest school that we have. So the plan will probably be to take the clinic out to the school and to start seeing. We got to see with Dr. Chris, we got to see quite a few people from the school in Purula, but there's still a lot of kids to see. And it's a lot more work having to do it with space and making sure with timing.
Awesome. So there's a question here. How available is good water?
Para los niños. For the children, right? We're talking about for the kids, I'm assuming, or
for kids or
just like clean water
for everyone. Yeah, clean water.
Yeah. It's fairly cheap to get clean water, but you do have to pay for it. So if you're going to choose between tortillas for your whole family or a thing of water, purified water, you'll probably just choose the tortillas if that's the choice you have to make.
Awesome. Another question here. Oh, sorry, Chris, you go right ahead.
No, I was just gonna say, we certainly see a lot of parasites and a lot of disease because of unclean water, unfiltered water. And so I think the kids that are in school obviously have great access to clean water when they're in school, but depending on their living conditions and where they're at, we certainly see a lot of diseases and illnesses from it.
Mm-hmm. Yeah, for sure. So this question, it can be answered by Dr. Chris or by Ruth. Are there any plans for lab services in the clinic?
Yeah, I can answer that. That's okay. So the labs that we do right now are very simple stuff. So we actually do pregnancy tests in the lab right now. We do urinalysis to obviously check for like urinary tract infections, can check for other medical problems with the kidneys. We check blood sugars in the clinic right now. In the past, we've had available some other things in the past, like screening was for strep and things like that. So right now we do some very basic things. I would definitely say a goal would be to have a lot more lab services in the future. They make some very good portable screening lab screens, things called like iStats, where you can, like, in 120 seconds, you can get answers on a lot of things like people's electrolytes, their kidney function, all sorts of things, different levels of different things. So certainly that would be great to have those. They're pretty expensive. They break a lot. In our United States or North American healthcare system, we can afford to get those replaced and things like that. So they are available, and I would say I would love to have those. I think we talked about the initial needs of the clinic, like right now, and the things we're getting up and running right now. That would be something that we would look to next. Like if we had more funding to say, hey, we have money to order some more things. Radiological services and lab services are things that would be expensive and somewhat difficult, but we could definitely get those in the clinic, and that would be wonderful to have. So again, I think we can do some basic things now. I would love to do more, and it certainly is a goal.
So what is the biggest challenge for the clinic now, in the future? Is there something that kind of sticks out in that?
That may be good for Ruth and I both to answer, and Erika, her challenges may be a lot different than mine. I would say the biggest challenge and need right now is dental care. And that's on my heart and what I feel like we just need. I can't tell you how many kids I see with dental problems, dental infections, just basically rotten teeth that need to be pulled. They're having pain, suffering, it leads to malnutrition, it leads to a lot of things. And historically, we have not had as many dentists come to Impact Ministries. In the whole country, there just aren't that many dentists. And so we're hoping, again, the next step would be get as many volunteer dentists as we could get from North America to come, and then work on, can we get a dentist with regular scheduled appointments like we are a doctor, so those would be great goals, things I would love to get. But for me, getting dentists there would be the most pressing need, and maybe the thing that's going to be the hardest to get, but we're sure working on it. I can say that.
Awesome. And Ruth, maybe I'll let you guys answer that question as well. What's the biggest challenge that you see for the clinic?
I think she's muted again.
There we go. Es en cuanto a higiene dental de nuestros niños.
The teeth of the children.
Es un problema muy amplio, muy frecuente en nuestros niños. Para mí sería el principal problema. Para seguir tratando.
We need to keep treating them.
También está en cuanto a la nutrición.
Nutrition.
La mayoría de niños,
many of the kids,
le falta un peso para
o el peso
ideal.
They're not at their ideal weight.
Y como tenemos conocimiento, eso impide a su buen crecimiento y desarrollo.
Keeps them back from developing as they should.
En cuanto a el desarrollo ideal, el desarrollo ideal que nosotros deseamos. Entonces, uno de los retos, digamos, de la clínica sería poder educar a los padres de familia para poder ayudar a nuestros niños de esa manera, y que los padres de familia tengan ese conocimiento exacto de cómo pueden ayudar a la buena nutrición de nuestros niños.
Their kids' nutrition to get better.
Awesome. And is there any fluoride treatment in the water?
No, it's not that fluoride.
We got lots of questions coming in here, so let's see. Just to clarify something that we already talked about, Vern, I know you had was wondering about teams having to quarantine when they arrive. So there's no quarantine that needs to happen when teams come, but they will need to get tested before you go back to Canada. And our next VidaLive is actually focused on teams, so we'll be able to answer lots of questions for that.
Yeah.
All right. So we do have a question here. How can people join a medical or a dental team? Chris, do you want to talk for a bit about that?
Yeah, so thank you. So that's great. So there's actually a couple of ways to join. If you actually go to our website, again, the Impact Ministries website of the USA or Canada, it actually has some open team dates. And so I'd say most of our teams, though, come from either a church or an organization or a physician gets together some friends or some colleagues, and they bring a medical team. Usually it's a trip that takes about 10 or 11 days. And so if you have a doctor and nurses and staff, and we use paramedics and EMTs and pharmacists and all that, if you have a team, then it's very easy to contact our team coordinator and come with a full team, a full set team, and we'll get interpreters and things like that for you. But so those dates, basically, if you have a date and time and a team already, we can, through the website and through either Kristen or Mel, who helps us on the US side, we can get you scheduled for a trip there. And again, typically they're about 10 days, sometimes a little shorter, sometimes a little longer, depending on what you want. But on the website, we also have open medical team dates on there, and those are for people to join up that maybe don't have a full time. So if you're a nurse and you're on the call and you're like, hey, I would really like to go and join another team, then we kind of knit together a team that we can. We always want to have a physician on every team. Would love to have nurses, interpreters, and other people, but we can usually get those together. So I think there's 6 open dates for next year for 2022 on the website now. So again, if you're interested in getting your own team together, we can get you some dates to go and do a medical team. If you want to join a medical team, go to the website, look at the 6 open dates, see if any of those fit your calendar. Then you can always email, again, Kristen, or through the website, email us. And again, we'll see what we can do to help you out, because we really do need providers and dentists. And again, if you know someone interested in going, we'll do everything we can to work with your schedule to get a team there for you.
For sure. So I'm going to ask this one last question, and then we'll kind of officially end the recording, but then we do just invite you guys to stick around. We'll let you guys unmute and just continue to ask some questions for the next little bit. But I'll ask this one other question about dentists and dental needs. So what kind of dental related donations are most in need at this time, and how do they best send them?
I don't know. I'll let Erika and Ruth answer if they can, if they know exactly what supplies we may or may not have now, but I can speak to it a little bit, I think.
Can you repeat the question?
Yeah, sure. I need to find it in the chat now. So what kind of dental related donations are the most in need at this time?
Necesidades para dental related, acerca de dientes. Dinero podemos usar sin dentista.
Sí, porque lo que se necesita aquí se compra en Guatemala. Nosotros hacemos.
Pero necesitamos un dentista para hacerlo.
Exactamente.
How do I answer that question? We need dental stuff that the dentists use when they come. But what we need is the dentist to come to be able to use them. So if we have the stuff, but we have no dentist. Is that, Chris, maybe we should.
No, I can say this, yes. The main is we actually need the dentist. It's actually a pretty, I'm not a dentist, obviously, but there's actually a lot of equipment there to do basic stuff in general, pulling teeth, fillings, all the anesthetics, all that we have that there. In the past, has been a problem with the equipment for sterilization has been a problem. As far as obviously we sterilize all the equipment continuously there, but if you have hundreds of patients and one sterilizer for the equipment and it breaks or doesn't work right or has an issue, then you call up the whole medical clinic. So in the past, it's been a real problem of having enough good equipment for sterilization. I'm sure there's upgrades on the dental stuff, but as far as donations, as we have in the past had lots of donations of just toothbrushes and toothpaste and floss, and our nurses go through with kids how to do that stuff, and if they have it available, I think they do a lot better job of it. So but any dental clinic dental equipment that's functional, especially one that would have anything for sterilization of equipment, those would be huge. And I would say they could talk to Ruth or Les about those. And then we actually have a doctor, Canadian doctor, Dr. Morella, who Michelle or Sandra may be able to speak better to, but he actually is kind of seeing the medical side of this, or I'm sorry, the dental side of this for us. And he's actually going to make a trip early next year as the plan to kind of go through, because it hasn't been used in a year and a half, to say, what do we have? What do we need? How do we get this functioning better? So we'll have better answers for that probably early next year before we start taking dental teams.
Yeah, for sure. Awesome. Well, again, I just want to say thank you to everyone for coming out today, tonight, whatever time it is for you and where you are. But just want to say too, thank you, Ruth and Erika. And it's just been such a joy to hear from you guys, from you, Dr. Chris, just about what's going on in the medical clinic. And we just love what you guys do. And we thank you for what you're doing. And so as I said earlier, there is our next VidaLive is going to be focused on teams, on short-term mission teams, which is really exciting. We're excited for next year to welcome teams back again. And that's going to be November 4th at 3 p.m. Guatemala time. So just keep that in your calendar. And we're going to officially kind of close the recording portion of this VidaLive. But again, stick around. We'll let you guys unmute and just continue the discussion. If you have more questions, we'll stick around for about 15, 20 minutes. So again, just thank you. And it's been just such a joy to be with you guys.